Let's take you to India now, where a severe second wave of COVID-19 is threatening to overwhelm the country's health systems, leaving people fighting for hospital beds, oxygen and medicines. Many parts of the country are under lockdown, including the nation's capital, Delhi. Nationwide, there have been 1,761 deaths in the last 24 hours. That is the highest death toll in a single day so far. On Tuesday, the Health Ministry reported 259,170 new infections. That is the world's highest daily rate. It has reported daily infections above the 200,000 mark for 6 days. And the country now accounts for about 1 in 3 of all new cases, according to the WHO. To date, more than 127 million people have been vaccinated. We will hear from our correspondent in Delhi in a moment, but first, Yogita Lamai reports now from outside a crematorium in Uttar Pradesh.
While we've been here, every 20 minutes to half an hour, we've seen an ambulance come in, bringing dead bodies in. We've seen families who say they've been waiting here for 14, 16 hours to perform the last rites of their loved ones. The surge they're seeing here is because of the coronavirus crisis. I've been speaking to people here who talk about their struggles finding hospitals, finding healthcare for their loved ones. A man told me that he had to go to 3 hospitals. Finally, his mother was admitted into the 4th, but by then it was too late, and on her death certificate it says brought dead, and today he's brought her here to perform the last rites. This is happening not just in Ghaziabad, where I am, but in many parts of India, as it's in the grips of a fierce second wave of the coronavirus pandemic. And hospitals across the country really are struggling to cope with the numbers that are coming in. People who could be saved are dying because they can't get an ICU bed. In some places, there's a severe shortage of oxygen as well. Some lockdown restrictions are now in place, but many are asking that it's now been over a year since the world has been dealing with the pandemic. Why was India not better prepared for this second wave?
Yogita Lamai reporting there. Well, let's take you now to Delhi, where Davina Gupta told me just how desperate the situation is in India's capital.
It's a race against time, Lucy, to save as many lives as possible, because right now in Delhi, a lockdown has been announced till Monday, and that's citing the public health emergencies and the challenges that Yogita pointed out of lack of oxygen supply, lack of beds in the ICU, and lack of crucial drugs to save lives. In my own neighborhood, I can tell you what these numbers mean. At least 4 families have been infected because of coronavirus, and these include children as well. A 29-year-old who struggled to get a bed in the hospital last night. I've been speaking to some of the senior administration officials in public hospitals as well, and one of them told me that the situation is so serious that patients are just lying in ambulances which bring them to the hospital for days, waiting for a bed inside the hospital, and doctors are trying their best to cater to them. Another doctor told me what Yogita pointed out is a reality in hospitals as well, that mortuaries are running out of space for dead bodies. And this is a grim situation because precious time has been lost to prepare for this kind of a pandemic. India was looking at numbers that were far lower in December till February. And in just about 6 days, we've seen a spurt of 1 million+ cases. The rapidly, or the speed with which this virus is multiplying in the country is becoming a key challenge for administrators, policymakers, and hospitals and families.
And very briefly, Davina, what's the government promising to do?
We've seen, Lucy, yesterday, 2 landmark decisions. One was to ensure there's a lockdown in Delhi at least, and some other cities are also following the same route for a week-long lockdown at least right now. And also we've seen some oxygen supply that is crucial to be made available to certain